Hey, welcome back to Becoming Soulful, my dear ambitious women. As usual, every Tuesday, I bring in very interesting personalities to share how they're pursuing their dreams and how they are able to manage their personal life and the professional life and still pursue doing what they wanted to do and to have their own identity. Today, I have yet another very, very interesting person. And hello, sir. Welcome back. Welcome, sir. Welcome, sir. Welcome on the camera. Yes, I
Yeah,
have Mr. Yogesh Wadhwani in front of us, and we are going to have a very, very interesting conversation. Hope this is going to add a lot of value to you and to your family. So, thanks for accepting my invitation.
yeah. Thank you. Thanks a lot for having me over. Yeah.
Thank you, sir. So, tell me something about you, sir.
So, um, so I'll first start with what I am basically, and then I'll share something about my family. So, I did my education, which is basically in electronics. I'm an electronics engineer, and I started my career from Calcutta. And right now I am settled in Gurgaon, Delhi. Uh, and in my family, my parents are there, my daughter, one single daughter, and my wife. And I have been working, I have an experience of around 30 years now. Started my career in 1991. And yeah, so it has been a good long journey. Uh, so that has been nice. Yeah.
Yeah. So you said that you are from engineering background.
Yeah.
But now you are taking care of preventive medicine.
Yes. So I basically work in infection control. I actually work with healthcare institutions on how to reduce and prevent infections which arise within their premises. So, which in medical parlance it is called as HAIs, or hospital acquired infections, and the earlier what people used to call it was nosocomial infections.
Loss of?
Nosocomial,
Also,
NOSO,
okay, okay.
nosocomial infections. So it's
Okay.
an old word, but nowadays they call it as HAI, hospital acquired infection.
Okay.
Yeah.
HAI, hospital acquired information, infections.
Infection. Yeah.
Okay.
Yeah.
So how do you go about training people? Who are the target audience and how do you go about training?
So my target audience is basically all healthcare institutions. So healthcare institution means the hospitals, which are they come first. Then there are blood banks, pathology labs, clinics, the large clinics basically, and blood banks. And apart from this, yes, there's the the medical colleges also. So that is a small aspect of the whole. So the main thing where the infections spread mostly are the hospitals, the clinics, specialized clinics like dental clinics, eye clinics, and the the what you call as the small trauma clinics where they do small trauma cases, and pathology labs and blood banks.
Yeah.
Now, now hospitals, because there is a lot of movement of people, the infection rates are very high, and especially the infections are very high within closed premises like the ICUs,
Mm.
ICUs, the operation theater, the HDUs. So these are the places where infections are very high and need to take care. And anybody going there without precautions can catch the infections.
Yeah.
So
So
that's how it is.
that was my next question. Who are much affected? Are the doctors, nurses, or the people like us who go enter the hospitals?
Very good question. So I will start this answer by sharing with you a data. Now, it is a research data, and uh, the data says that if you go to a hospital in USA, after the 26th visit to a hospital, you will catch an infection. Okay. Whereas if you go into a hospital in Europe, on an average, so there are so many countries, on an average, if you go to a hospital in Europe, after the 22nd visit, you will catch an infection. But if you go to a hospital in India, after the 4th visit, you will catch an infection.
Okay, at least 4th visit. Okay, that first visit. Okay. Okay.
Yes. So
even
earlier,
in sophisticated hospitals, even in sophisticated hospitals.
Even in sophisticated hospitals. So now, if you ask me, who will catch infection? It is everybody. Everybody has to take precautions. So the healthcare staff inside the hospitals, they are less susceptible to catching infections because they are inside that same environment. Their normal flora takes the flora of the atmosphere inside, so they tend to get till their immunity doesn't go very down, they will not catch an infection. But for somebody who's coming into the hospital from outside, or whose immunity already is down, who's being admitted in the hospital, they are definitely going to catch the infection very quickly. So what we call as immunocompromised people, whose immunities are very down. Yeah. So they will catch infections.
Very, very scary, very scary. Okay, so my basic request would be, can you help us with at least 4 points as to how a common person like me, who will visit somebody else in a hospital, can take care of themselves, irrespective of me knowing about my immunity level?
You mean to say how you can take care inside the hospital?
So when you said this, the first thing came to my mind, a flashback of all the visits I have done in the hospitals.
Correct.
And then so scared of listening to you that 4th time I will get, but what are the chances of me getting it, and how do I in general take care of myself irrespective of the hospital environment?
Great. Very good question. So if you go into hospitals in USA and European countries, which are developed countries, any developed country if you go to, they do not allow visitors inside ICUs or STUs, or even that, for that matter, even for any reason, to enter any sterile area. But in India, anybody can go anywhere. And if somebody is stopped, there will be fights.
Yeah.
And the whole family will gather around,
Yeah.
and so there will be a lot of I don't know, it can lead to anything. So the thing is, to prevent that, there are certain rules. And so in foreign countries, everything is process driven. They work in systems. Whereas in India, it is, though there are systems and processes which are slowly coming into the picture, still it is a human intervention everywhere. So that is something which causes a lot of what you call spikes in the infections. Now the thing is, most importantly, uh, the most important thing is washing your hands. Now, in somewhere in 1800, there was this doctor, obstetrician, I don't know, I'm forgetting his name, Ignaz something, W starts his name, Ignaz. And he actually found out that that the doctors who were performing autopsies, they were straight away going into the operation theater without washing the hands. So, and that's how infections were increasing. And it is that time when it was found that you should be washing your hands. And then they used these carbolic acid, chlorine lime solutions. It started like that, slowly. But still, there are doctors who still forget to wash their hands. After doing something, they still forget to wash their hands. They're either too worked up or stressed out. They sometimes forget to wash their hands, and it can lead to an infection. So, there are the systems and processes are supposed to be very important. And that's where you need to have checklists everywhere. So checklists are very important. So even if you get into a clinic, you need to have a checklist, what the doctor has to do, what the healthcare staff has to do, what a patient has to do, everywhere. So that's how hospitals need to run, with systems and processes. Most importantly, hand hygiene is very important. The way of washing hands is also very important. Now, normally what happens is when you wash hands, the thumb is left. Thumbs are normally not washed. Now, when you do it, they are not washed very well.
Like this, yes. Yeah.
Thumbs are normally not washed. So whenever you wash, thumbs, they stand out mostly. And if you're in a hurry, the thumbs will, so only this part will be washed. These parts will, so any bacteria, which is, you can call it as resident bacteria, can go through your skin and stay within the skin level. So there are two types of bacteria, transient and resident. So transient bacteria, you wash your hands, they are washed away. Yeah. But certain bacteria, once you're washing it and this thumb, they are not washed properly, they will go inside in the epidermal layer and they will stay there. And that's how they will go from one host to another. They will transfer that infection. So, and that is where it is important to wash the hands also properly. And that's why there is a certain protocol, the way of washing the hands in the hospitals and any healthcare establishment. And that's that's the biggest training that has to be given. And that also a lot of people do not follow that method because it is little time taking. And you need to wash your hands for at least, I'll say at least 45 seconds properly.
I think after Corona, people are a little more sensitized and.
Yes, so I'm afraid to say Corona has taught people in the 21st century how to wash hands.
Yeah, at least there's something like this. We are reminded of that. So whenever we wash hands, as you said, we don't do systematic way. Washing is like how
you need to. So you have to wash your hands like this. So like this on the back also. Then you have to clasp your hands like this.
Yeah.
Like this.
Yeah.
So
I watched a very interesting video where some of the volunteers, the hospital cleaning volunteers, have created a song on that.
Right.
It was very interesting. If I find, I'll send it to you. How to wash hands so that normal laymen will understand with the song, and they found it very interesting to connect. Yes,
that
please
should be very good. If you get it, you can send it to me. Yeah, great. So, as I said, transient and resident. So this is very important. So washing hand is very important, and especially for a doctor in the hospital, when they move from one task to another, they cannot wash hands every now and then. Yeah. So they normally use an alcoholic what you call sanitizer, and so that sanitizer they use and they rub it. Now that rubbing has to be done for at least 30 seconds to kill any bacteria or virus, and that is why the making of a sanitizer also is very scientific. You need to have, it should not evaporate very fast. So moment you touch it and it evaporates, then it doesn't help you to kill everything. So it will happen, the same thing will happen just like a soap and water solution. The whole hand will not get sanitized. So you need to have a sanitizer which has at least 72% alcohol, ethanol, which will actually kill all the bacteria and viruses. So that you have to rub, and for 33 seconds do that, and then you are assured that yes, you are not transferring infections. Yes, hand hygiene will take care of 50%. as per studies, I think it is around 54-55% of all the infections that arise in a hospital.
Yeah, very, very. After when I hear this, after Corona, it becomes easy to understand. Whatever you said, I'm able to
Yeah.
relate with them, easy to understand. What are the common infections which comes under HAI?
So the common infections, mostly they're all related to specialized bacteria. So the common infection, I will tell you in a very layman language. I'll not talk about the name of the bacteria, but yes, pneumonia is the first one, which is high on the list. You have uh, what you call gastrointestinal problems like diarrhea, dysentery, and mostly diarrhea that can happen. Dysentery also. And then you have skin infections that can happen to you, and respiratory diseases like though pneumonia is on the top, but yes, the other diseases can also happen to you. So these are basically all the infections that can happen just through the air, the normal flora of the air. But if there is a water contamination, then yes, the as I said, diarrhea is one, skin infection is one, and subsequently you can have eye infections and even the the mouth and throat infections with that. Similarly, food also in a hospital, canteen is there. So that also will cause throat infections, gastrointestinal problems, and the linen that you have on which you sleep, if that is not washed properly, uh, the the bed cover, which is the linen, below that is the mattress. Now, if that mattress is also not, so most of the cases, hospital mattresses are not clean. They are they normally uh, covered by one cover
Sheet.
that is washed,
Yeah.
sheet, and then they put another sheet on it. So what happens is those mattresses are there for a very long time, for months together, till they are discarded. So they are normally discarded once in a year till it becomes very bad. So there are resident bacteria there also, and there is a specific way of cleaning them. So all the hospital, and it is expensive. Cleaning that is not so easy. So a lot of hospitals don't do it. But then yes, these are the sources from where AC ducts. Now AC ducts cleaning is also expensive. You have to get somebody from outside, bacteria, viruses, especially you can say spores also, which are dangerous. They go and stay there, fungus. So they are all resident inside um, the AC ducts, and in the you normally switch off the ACs. The central AC is normally switched off during the winter times in the cooler areas, and that is the time when they reside inside the bacteria, viruses, all the germs reside. And then when you put it on, should be cleaning it regularly. So somewhere or other, you cannot escape these germs, because water is there, your food is there, your air is there, and everything nowadays, because all the hospitals are following a Western model. So they're all glass doors and everything, cubicles and all that. So you can't escape any germ from anywhere. And that is why you need to be doubly careful of what we are doing and how we are doing it
So the
inside a hospital.
structure has been aped, but the cleanliness hasn't been aped.
Exactly. So, and most of the hospitals, uh, they use the expense, they feel the expenses are very high on reducing infections. But it has been seen that if the the increase in budget for a hospital is only 1 to 1.5% on the products, on good products, and the benefits they get of reducing infections is around 14 to 18%. So just 1% here, and you're getting a benefit of 14. It is a big difference, but they don't realize that. And And that's where I come in. I actually train them. I tell them which product is good, which you should not use. There are local products which probably just have a color and they don't have any. They're probably using kerosene and they're not using alcohol. They're not. They cannot judge and find out. Doctors are not trained for that thing. They're trained for certain other things.
Is it
So
not
these
part
are.
of their syllabus? Is it not part of their syllabus?
Oh
These
yes,
are
definitely. They as products, they definitely know what products are to be used. But as a trained person, see, for example, I sell sanitizers day in day out. Now I know which sanitizer is good because I can touch it, feel it. I know every day. I can immediately tell whether the sanitizer has got kerosene in it or it has got alcohol in it just by the feel of it.
oh my God. Okay.
So you, it's a training that you require. It's not, and if I don't give you that training, you won't even come to know
Correct.
what does it have. So definitely that's how training comes into play. Why I say is training is 50% of the job done. And so if training is there, I will say yes, there will be a big jump in the reduction of infections in India.
Beautiful, beautiful. Okay, before I'm curious to ask one more question because my daughters are dentists. So you mentioned
Okay.
that there is more infection for the dental clinic as well. Can you throw a little light on that?
Yes. So there are two aspects. Normally, a dental clinic should have a separate area. Um, um, they should have a separate reception area, which should be separate from the where the procedure is done, from the procedure room. But what I've seen is 60% of the dental clinics have a common area. That means the moment you enter, the reception and the procedure area is all one area, one unit. Yes, the only thing is, yes, reception is a separate, secluded part of that whole area. It's not a separate room or a cubicle. And I can understand because of space reasons that a lot of people do it. But in spite of that, they should have a separate cubicle to separate that. What happens is, and another thing is, you should, when in a dental clinic, we should be leaving the slippers or shoes outside, not to come with those inside, because that is the first instance. In a hospital or clinic, you, I don't know whether you have seen or not, we don't do any brooming. No jhadu is used. Okay,
Vacuum
because if
cleaners?
you think, no vacuum cleaners,
Okay.
because the whole dust is brought
Great.
up, and that will go into the circulate into the whole area, because you have a central air conditioned unit, and outside there are air handling units. Outside air comes into the, is filtered and brought inside the hospital. Now if that goes up, it will create a lot of chances, multiply the chances of infection. So that's why no brooming is done inside any healthcare institution. Only mopping, pocha is done.
Yeah.
And mopping also with a correct product, and there's a certain technique of doing that also. And even why I say the product, because the floor has to be wet for a certain period of time, so that when it forms a layer, it kills whatever resident bacteria is there on the floor. So it should take at least 30 seconds to a minute for it to evaporate. It should not evaporate immediately. So that's how there's a science behind the whole thing. Now similarly, now in a dental clinic, coming back to the dental clinic, now in a dental clinic, uh, normally what happens is, dentists, they, when they are doing the procedures or talking to the patient, who patient is on the chair, so they do procedure and they write also.
Mm.
They keep on writing on the chart. They have a chart next to them. There's a place on the chair itself where they can write. Now they have gloves, they're doing everything, but the pen and the chart is all inside that area. That is getting infected with the flora of the patient that is there. Now that chart goes outside.
The X-ray, they see the X-ray.
Everything. So everything is there. It is being put in that chart. Huh? It's there on the file, and that thing goes out to the reception area.
Oh,
Now
yeah.
Now what is happening is you're increasing the chances of infection to furthermore for the people coming in and for people going out. Okay.
Very
Now,
scary.
in a human being, normally, I I will probably be having maybe 6, 7 different types of bacteria in my body. There will be a bacteria in my mouth, in my nose. There can be something in my ears, body, in my in my pelvic region, a different bacteria, in my foot, a different bacteria. Now, most of the people carry these bacteria, and they're okay, they're fine, they got used to it. Now, it might now supposing if I take out the tooth, for example, or I'm doing some implant and blood comes out, bacteria will immediately go into that. Bacteria needs a host with a direct access. Now, if your air inside is not decontaminated, you have a very high chance of getting that infection. So after every procedure, there should be a decontamination done for the room. Now, we we suggest that you use a certain equipment to decontaminate that, and a liquid is used to decontaminate it. And you decontaminate it within, so between every procedure you use for 30 minutes, there should be a gap so that you decontaminate it and reuse the next patient. So the chances of infections are nearly eliminated that way. And the charts also, the doctors should not be writing on their own. They should have an assistant, sorry, who should be writing for them. So she should be talking about it, she should be telling, and the person is writing, so that chart also is not infected, and that's how it goes out. And most importantly, no brooming inside. Everything has to be mopped.
Yeah, I haven't seen any hospital being groomed in the recent past. Yeah, mopping is done. I understand that. What is one, if I give you last 90 seconds, give us one piece of mind information for our audience, or suggestion or advice, because whatever you said, whatever I heard is so scary. One good news is we Indians are highly immune because of the lack of cleanliness. That is one common saying we say that. Unlike Westerners, we are not very sensitive to illness. But that cannot be taken for granted. So we still have to comply all this. So what is one piece of advice for all our audience, Doctor?
So I will suggest the most important advice is that you should wash your hands. Your washing hands should be so ingrained in your system. Before eating food, before doing the next task, you should be washing your hands. And even when you're touching something, so what happens is, if I touch something and somebody else touches the same place, the infection can pass. So that's how we should be washing our hands, so that the reduce of the infections are reduced. And we should not fight to go inside an ICU in a hospital. We should let doctors do their job properly.
When I am a patient, I look at it in a different way. When I am a visitor, I look at it in a different way, because recently when I was admitted in the hospital, and the thing happens in India is there is no common rule. Some people are allowed, some are not allowed. So I get a feeling, why my husband is not allowed into ICI, somebody else is standing there already. So the desperation, as a patient, there is a desperation, like you want my person inside. So I completely agree with that. So there are two things. One is frequently we have to wash the hands, and number second one is make sure we don't get into ICUs because of this reason. Can I ask you a few questions, personal questions, Mr. Yogesh? What is that concept of life for you? It's just some personal things I want to ask. What is the concept of life for you?
So life for me is, I'll say it is one.
Okay.
Just say it is one. And
you have to fill in this blank. Life is like a dash.
So that way, so life is like a journey, I will say.
Beautiful. Okay. My next question is, what book would you recommend most often to people? Book, if you want to recommend any life book.
There are so many books. So I would like everybody to do well in life, and so I will suggest this book by if anybody can read The Secret. It will take some time for them
The
to
Secret.
understand.
The Secret?
Yes.
Okay.
Yes.
Ron
Great.
O'Brien. Ron O'Brien.
They should at least read it for 3 times.
Okay. Okay.
Yeah.
This morning I browsed on The Secret book, but there's one more version of it. It's called The Power by the same author.
Same author,
Okay.
yes.
Yeah.
Yeah.
The next question is, what have you started or stopped doing to live or age well? What have you started or stopped doing to age well?
So I'll say what I started was at the age of 16, I started exercising. And I have continued that. That is one thing to reduce your aging, not from the what you can see on my head, but yes, from by mentally as well as internally, solely you can say. And starting is something you can pick up any good habit, like getting up
What
early.
did
It
you
all
stop?
depends.
What did you stop doing in your life?
Okay, what did I stop doing? I stopped reacting. Yeah,
I
that's
could
what I
see
did.
that. I experienced that today. I experienced. Yeah, guys, my system hanged and Dr. Sir was waiting for almost 15 minutes to start the session. Like, he didn't react at all. He was with a smiling face. I felt so embarrassed, but thank you so much for that. Yeah, you proved it today. Yes. What advice do you have about making relationships work?
So again, it boils down to the same thing. We as human beings, there is an inner voice that keeps on talking, and it messes up our system, our brain. And you can, it's like a what you call a monkey yapping all the time. You continuously, that talk disturbs you. So, and we assume so many things because this inner talk is going on, and that's how we are reacting.
Yeah.
Now, if somebody, for an example, if somebody doesn't tell anything, it just comes and goes away back looking at me. Now, my inner voice might tell me he didn't want to talk to me. Now, my inner voice is telling me he didn't tell me. He just walked away. Probably he saw something behind me. I don't know why he went, or he forgot something to get something. But my voice is telling he doesn't want to talk to me. Now, this inner voice is something that has disturbed my peace of mind. So that's how, this is the thing you should control. You should learn to control and stop that inner voice from disturbing you.
Beautiful. If you have to appreciate your wife, and if you have to describe her in one word, what will be that?
Beautiful.
Beautiful. Okay. In and out. Yes.
Yeah.
And if she has to compliment you in one word in your absence, what she will say about you?
What will she say? I think it will be. I'm like loss of words, but yes, I think she might say. What do you call dynamic? Yeah. Dynamic will be a word.
Yeah. One advice for money.
One sentence I will say: it comes and goes.
Okay.
Today it is not there, tomorrow it will come again.
Thank you. Thank you so much for your time. And it was highly informative. And if required, I might ask you another session to go in detail about all these, especially as to how children can be saved, how family can take precautions, how patients can take care of. I have all varieties of patients in my own family. So I'm so curious, a lot of questions are popping in right now. You might
Sure.
have to go for another session. Thank you so much.
Sure, you're welcome.
Yeah.
Thank you.
Thank
Thanks
you.
a lot for having me. Thank you.
Thank you.
Bye.
So that's it from Mr. Yogesh. He's doing a wonderful job of orienting and training people on how to take care of our health and preventive illnesses, especially it's called as hospital acquired infections. So that must have been a very, very informative and a different new topic for all of us. Hope you would have enjoyed, learned a lot, and you will be more cautious when you visit hospitals, and you'll be keep on washing your hands whenever it's required, and you will ensure not to fight with hospital doctors to enter into an ICU. These are the two takeaways I can take from this interaction. The whole interaction will be more cooperative, understanding, getting the awareness that there are many hospital acquired infections. So I'll come back again with yet another interview. Thanks for watching, and please believe in yourself, begin the action, and bloom gracefully. Hope you got a lot of inspiration. If you have any questions, please put them in the description box. We might invite Mr. Yogesh again for another interesting interview as well. Thanks a lot. Bye for now.